Hey, I'm Chelsea Melton.
I'm David Shepard.
I'm Cassie Mincy.
This group, or nurse management, we are called Lord have MRSA. We are going to talk about quality control for our project today. Take it away, Denver.
So when somebody talks about quality control and management and leadership, a lot of times I think control is like this overbearing type personality, but in reality it's rather an endless process of evaluation. It's an evaluation of the individual and a group standard that were previously set by the organization. Quality control is a type of control. It is used to monitor the process of your standard and also to evaluate if the process is going as you planned it to. The standard for your goal needs to be achievable and realistic while meeting federal and state regulations. In nursing, we strive for excellence, so quality control programs should be expecting top quality results, not minimal results. This isn't a one-time program, it's an ongoing program for the duration of your company. In order for quality control to be successful, you need a manager that is well versed in the expectations of the company. They need to have good leadership and management skills. In the IOM, which is the Institute of Medicine, defines healthcare quality as the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. So if the care is to be high quality, it must be up to date with current knowledge. The quality control process can be problematic and the measurable benchmarks can be even more difficult. To view this process in a simple way, but you can break it down into 3 steps. The first step is to determine what that standard is. The second step is to gather information that determines if the standard has been met. And third, a corrective action needs to be in place if the standard has not been met. First, the standards vary from institute to institute. So the leader and the manager must see that all staff members are well educated and knowledgeable up on the process and the standard. So how can you measure if the standard is being met? One way is to compare with high-performing organizations. This way, everyone's performance can be measurable by comparison. Number 2, some things to compare and measure can be the program itself or the protocols related to improvement of life, the quality of care, staff development, and cost effectiveness. When comparing to other organizations with top-performing healthcare, there is a report that is obtainable where one can see the quality gap. And 3, the organization needs to determine ways to collect data. This data must be related to the criteria you are trying to see how you are measuring up to, and it needs to be current. Sources of information can be even patient's charts or even flow sheets. Once information is gathered, you can see if the standard has been met. If the standard isn't met, you will need to investigate why and counsel employees as needed. If the unit goals are not met regularly, the leader or manager needs to see if the goal was not achievable. When determining your standard, you must make it objective, measurable, achievable, and the American Nursing Association is a great source for developing a professional standard.
Something that's important in healthcare with quality control is audits. So an audit is a systematic and official examination of a record, process, structure, environment, or account to evaluate performance. There are 3 audits, and the first one is outcome audit. It determines what results, if any, followed from specific nursing interventions for patients. So the second audit is process audit, and they are used to measure the process of care or how the care was carried out. The third audit is structure audit, and it monitors the structure of setting in which patient care occurs, such as finances, nursing service structure, medical records, and environmental structure. The next thing is going to talk about standardized nursing language. There are 13 standardized nursing languages that were approved by the ANA, and they are listed above. One of them has been retired. As standardized nursing languages provide a consistent terminology for nurses to describe and document their assessments, interventions, and the outcomes of their actions. The next thing we're going to talk about is quality improvement model. A quality assurance, which is QA models, are to seek to ensure that quality currently exists, whereas QI, which is quality intervention models, assume that the process is ongoing and that quality can always be impaired. Professional Standards Review Organization, it critics of the PPS, which is Prospective Payment System, and that argues that although DRGs, which is diagnosis-related groups, may have helped to contain rising healthcare costs and the associated rapid declines in length of hospital stay and services provided have resulted in declines in quality of care. The last thing I'll talk about is the Joint Commission. The Joint Commission is the major accrediting body for healthcare organizations and programs in the United States. It also administers the ORYX, ORYX initiative and collects data on core measures in an effort to better standardize data collection across acute care hospitals.
And drawing on what she was talking about, the Joint Commission, they also deal with sentinel events, and it is outlined in the chapter on page 626 under display 23.7. The sentinel events are defined by patient safety events unrelated to natural causes of patients' diseases and diagnoses. Examples of these are clearly listed on that box. Just some to name are death, of course, permanent harm, and it also includes rape, suicide, and discharging of an infant to the wrong family. Another significant aspect of quality control is maintaining national patient safety goals. Some examples of these would be identifying the patient correctly, increasing communication with staff, prevent infection, and proper medication administration. And when I just want to expand on that a little bit. Medication reconciliation, which is to compare medications that patients are currently taking to the new medications. And we all know this at this point because this is what's done to decrease medical errors.
Yeah. And off of what Aaron said, reducing medical errors is the leapfrog group for evidence-based standards that is to try and help prevent medical errors with computerized physician-provider order entry. It's to intercept errors when they're most commonly occurred is when they're actually being put in. The computerized physician-provider order entry has been shown to significantly reduce serious prescription errors in hospitals by more than 50%. Evidence-based referrals, I guess we need to go back to you then.
Sure.
I'll finish mine.
Thank you for providing that information. Also, Medicare and Medicaid services are also under the Joint Commission, and this has been put in place to assist patients to make better informed decisions. Also, pay for performance is clearly highlighted also in this chapter, and that deals with value-based purchasing, physician quality reporting system, inpatient quality reporting program, hospital value-based purchasing, and readmission reduction programs, and all would fall under the categories of Medicaid and Medicare services. Also, hospital consumers assessment of healthcare providers and systems. This is talking about surveys. And this surveys was the first national standard public reported personal patient view of how their care was, how they received their care. And lastly, regarding Medicaid and Medicare services, the multi-state nursing home case, mix, and quality demonstration is outlined under this title. And this deals with the mix between funding and how they receive payments, and the quality of care that was provided by all the staff members. Moving on to National Committee for Quality Assurance. This organization measures all aspects of care ranging from the quality of care, outcomes of that care, and their financial dependency and whatever services they needed to be financially set up for services. And so they deal with like the overall big picture. But the only one downfall with this organization is that their accreditation is voluntary. And the last thing I'll point out is a national database of nurses' quality indicators. And this was founded by the ANA. We all know that's what that is. And it is all about nurses rather than being patient-centered. So it stresses on the staff rather than the patient for quality control as well. So.
And again, to go along with the Leapfrog group, there's 3 more added into that, which is the evidence-based hospital referrals, intensive care unit and physician staffing, a national quality forum which endorses safety practices. The FDA has suggested that a drug barcode system be coupled with a computerized order entry system that would greatly decrease the risk of any medication errors. The point is to try and prevent as many medication errors and deaths as possible. Another approach that has been taken to create a culture of safety and management is the 6 stigma, which is above. It suggests that defects should be limited to outside of the 6 standard deviations. And historically, our healthcare system is only ran off of a 3 stigma process, which right now is the reason why the United States has, I'm trying to find it. This is the one main reason why our healthcare has more errors than the banks or airline industries, where they use the 6 stigma approach. For quality healthcare to be achieved, organizations, cultures need to be changed for employees and patients to feel comfortable in reporting hazards that can affect patient safety without fear of personal risk. Quality health care has emerged as critically important but is underachieved in the United States. Preventable medical errors are now the 3rd leading cause of death in the United States following heart disease and cancer. Medical errors kill more people than car crashes or new disease outbreaks. They also kill more people annually than breast cancer, AIDS, plane crashes, or drug overdoses. Those deaths as a result of medical errors could fill an average-size Major League Baseball stadium sometimes twice over. Of care.
Well, just since you can edit this to go back on Aaron's performance for pay, it's still illegal in 2019. Performance for pay, hookers. You don't remember what you said. You're a goober.
Now?
Yeah, you said performance for pay. You went on into like.
Oh.
I said it's still illegal.
I'm sorry. I'm sorry.
It's illegal.
Pick
It's
back
not
up.
right. Promoting prostitution in healthcare. Job security, STDs.
Again, along with the Leapfrog group, the States has, I'm trying to find it.
I think y'all got schizophrenia.
Oh, yeah, here it is.
I ain't seen nothing above yet. What the I've been looking for that the whole time.
This is one of the main reasons why our healthcare has more.
I was doing one of the main reasons again because I was. Everybody the camera.
Twice over.
And I'd like just to add that real quick. And never mind, I'm not adding to anything. I guess cut that.